organ transplant business and network governance has been in shambles for decades, and people have needlessly died because of it. And we have passed very good legislation on unanimously to correct it. So I come to the Senate floor today because I have very serious concerns about the Biden administration's implementation of H.R. 2544. That legislation goes by the title of Securing the U.S. Organ Procurement and Transplantation Network Act. I'm joined by a colleague that's worked real hard on this issue, Senator Moran of Kansas, who will also give his views on this issue. He worked with me and championed this very important issue. On September 22 of this year, this legislation, H.R. 2544, was signed into law by this president. In less than 3 months, the Health Resources and Services Administration of the Department of Health and Human Services is already ignoring congressional intent while asking Congress, can you believe it, for money to implement the law, and is presumably to implement it in a law contrary to what the legislation requires. Now, I'm proud to have been a co-sponsor of this very important bipartisan piece of legislation. We fought alongside patient organizations that knew this whole setup for decades was not working the way it should. We did this with the hope and expectation that we'd have real competition to manage our organ donation system. Congress unanimously passed the bill, as I said before, we were able to do it without attempts by a lot of people within the 40-year-old organization that runs this program that tried to kill it with what we call around here poison pill amendments. And that point is very important because we didn't adopt any of those amendments. And yet we see some of those amendments, approaches, being now promoted by this administration on the implementation of this bill. Because these potential poison pill amendments would have prevented competition in our organ donation system. And we felt that competition was what we needed instead of the monopolistic approaches that had existed for decades. And you can imagine these amendments were pushed, yes, by the same nonprofit monopolies that have called the shots in our nation's failed organization system for the last 40 years. So here is where we are within just 3 short months after the passing of what we thought was real reform. Now the Health and Resources and Service Administration of HHS, led by Administrator Carol Johnson, has attempted to restrict competition right out of the gate by inserting, via contracting process, the very poison pills that Congress kept out of the law. For example, that agency announced plans to install the existing United Network for Organ Sharing Board, the one that's been running the show, as the new so-called independent board. regarding limiting competition for board contract, agency officials told my staff and staff from other congressional offices that, quote, the agency can place restrictions on any contracts, including the IT contract, end quote. Again, the purpose of this legislation was to create competition, not stifle it with government restrictions and sweetheart deals. My bipartisan oversight over the years has shown that the United Network for Organ Sharing IT system is failing at every level. I've heard from patient groups and leaders these very same concerns. These patient advocacy organizations are rightfully concerned that HHS today is caving to bad actors who've been running our nation's organ donation system since 1986. As the president of the Global Liver Institute wrote, quote, I never imagined that industry could so quickly dictate the terms of the law's implementation, end of quote. The National Kidney Foundation wrote that these proposals, quote, continue to empower those who've been responsible for the problems that have plagued the transplant system, end of quote. From what my staff has been told, Health Resource and Service Administration officials have threatened the very patient groups writing those letters to me and other members of Congress. The Health Resources and Service Administration allegedly told some of these patient groups to retract their letters of concern and that their letters were a lie. All of this is unacceptable and should be to 100 members of this body who passed this legislation unanimously. I started working to fix our nation's corrupt, broken organ donation system way back in 2005. Since then, more than 200,000 Americans have needlessly died on the transplant waiting list, disproportionately for people of color and people of rural America. Patients in Congress fought for this legislation. Now, HHS, under this administration, needs to implement this law in the interest of patients. Patients' lives depend on it. 200,000 lives over 40 years lost because of how this organization has distributed or lost, or 100 other ways you can say the organ not getting to the patient that it was intended. Maladministration by the organ network must stop, and it looks to me like HHS wants to keep it going as it is and prevent and stand in the way of this important piece of legislation.